Proposition 11 requires private sector emergency ambulance employees to remain on call during work breaks, eliminates certain employer liability, initiative statute. Plain language, allow for ambulance workers to stay on the clock during break times and mandate special training and mental health benefits for ambulance workers. The background. 75% of ambulances are actually owned and operated by private companies. The other 25% are run by local fire departments. 66% of ambulance trips are for patients with government insurance, such as Medicare or Medicaid. 20% of trips are for patients with commercial health insurance, generally employer provided, and the other trips are for uninsured patients. Commercial insurance pays more for ambulance trips than government insurance pays. The average cost of an ambulance trip in California is $750. Medicare and Medi-Cal pay ambulance companies a fixed amount for each trip. Medicare pays about $450 per trip, and Medi-Cal pays about $100 per trip. As a result, ambulance companies lose money transporting Medicare and Medi-Cal patients. Ambulance companies also lose money when they transport patients with no insurance. This is because these patients typically cannot pay for these trips. To make up for these losses, ambulance companies bill patients with commercial insurance more than the average cost of an ambulance trip. On average, commercial insurers pay $1,800 per trip, more than double the actual cost of a typical ambulance ride. Each California county creates zones and bids that section of the county out to an ambulance company that makes the best bid. The winning ambulance company pays the city in exchange for exclusive rights to that zone and makes its money by billing the insurance companies of the patients. The ambulance companies create agreements with the county that detail the expected response times to emergency calls and information on expected profits for the specific zone they are working. An area with more privately insured residents would yield higher profits for companies, and an area with more government insured and uninsured patients would generate less revenue. To respond quickly, most ambulances are not stationed at permanent locations. Unlike fire department crews who wait for emergency calls at their permanent location, most ambulance crews are positioned throughout the city or region to anticipate 911 calls. After a 911 call arrives and the nearest ambulance responds, other ambulance crews in the area reposition to cover the area again for the next 911 call. This practice is known as posting. Lets the ambulance provider meet the response time requirements in its contract while using fewer ambulance crews than would be needed if they were stationed at permanent locations, resulting in lower overall costs. EMTs and paramedics. There are 17,000 emergency medical technicians, or EMTs, and paramedics in California, about 3,600 ambulances. EMTs provide first aid and basic medical care. Paramedics provide advanced medical care. Ambulances have 2 crew members, 2 EMTs, an EMT and a paramedic, or 2 paramedics. Ambulance crews normally work 12-hour shifts. Emergency response personnel, such as police officers, firefighters, EMTs, and paramedics, often experience traumatic events during work. These work-related injuries include natural disasters, terrorism, or accidents involving children. As a result, people in these jobs have higher rates of post-traumatic stress disorder, or PTSD, depression, and suicide than the general public. Many ambulance employers offer counseling for staff who have experienced a traumatic event. Some employers also provide wellness education and mental health service plans. Some EMTs and paramedics receive additional training. State officials, in coordination with private ambulance companies, oversee training to help EMTs and paramedics respond to natural disasters, situations involving active gunfire, and acts of terrorism. These circumstances require special responses, such as removing injured patients from dangerous areas, not included as part of a standard EMT or paramedic training. Employers must follow state labor laws about medical and rest breaks. California employers must follow various labor laws, including rules about the state minimum wage, how many hours can be worked, health and safety in the workplace, and meal and rest breaks. Most employers provide an unpaid 30-minute meal break during each work shift and a paid 10-minute rest break every 4 hours. And this is mandatory. In practice, EMTs and paramedics are on call for their entire work shift in case they receive an emergency call. This means that their breaks are sometimes interrupted by 911 calls. They can also be interrupted by a request to reposition to a new posting location. As a result, EMTs and paramedics are often unable to plan their meal and rest breaks. At the same time, most ambulance shifts include downtime between emergency calls. Urban areas tend to have less downtime than rural areas do. As a result, crews often have enough time in their schedule to take uninterrupted meal breaks and rest breaks, even though they are technically on call. However, in 2016, the California Supreme Court ruled that on-call breaks violate state labor law. Instead, employers must provide breaks that are off-duty and not interruptible, even if an emergency occurs. The decision was Augustus v. ABM Security Services. The case involved private security guards whose employer required that they keep their radios on during breaks. The court awarded the company's security guards payments due to the violations. Before the Augustus decision was made, EMTs and paramedics had filed several similar lawsuits against private ambulance companies. These lawsuits are still active. To follow state law, according to this recent lawsuit, ambulance crews would have to go off-duty during their meal and rest breaks. As a result, in order to meet the terms of their existing contracts, ambulance companies would likely have to operate significantly more ambulances in each area than they do now. This would increase costs to ambulance companies, potentially by more than $100 million a year statewide. To address these higher costs and still remain profitable, companies would need to raise revenue and/or reduce costs. Companies could negotiate a legal agreement that would allow for a partial implementation of Augustus, increase insurance charges to private insurers, reduce business costs by lengthening their response time to emergency calls, replace higher paid paramedics with EMTs, who are generally paid lower wages, or they could pay lower exclusivity fees to counties or eliminate them altogether. While ambulance companies will be able to offset some of the needed costs to comply with the new Supreme Court ruling, it is expected that counties will absorb the brunt of the increased costs. Long story short, California law requires all workers be allowed off-the-clock meal breaks and 10-minute rest breaks. However, ambulance workers have typically been expected to take their break time during their downtime between calls. Now, due to a new court decision, Augustus v. ABM Security Services, ambulance workers are required to have off-the-clock meal breaks like everyone else. This, however, will greatly increase the cost of providing emergency services to counties. Prop 11 seeks to have an exception to these break time rules for the ambulance industry. Prop 11 requires EMTs and paramedics to stay on call their whole shift as they have been doing before the lawsuit. It requires that the meal breaks not be during the first or last hour of the shift and be spaced at least 2 hours apart. It also requires ambulance companies to operate enough ambulances to meet these meal break schedules. Prop 11 becomes retroactive so that all existing lawsuits against ambulance companies that involve this mealtime conflict be dismissed. This measure requires ambulance workers to offer EMTs and paramedics 1. Annual natural disaster, active shooter, and violence prevention training, 2. Mental health and wellness education, and 3. Mental health counseling sessions, and 4. Access to long-term mental health services. Prop 11 applies only to private ambulance companies, not public paramedics or fire department paramedics. Fiscal impact. If ambulance companies were to offer the mandated off-the-clock meal breaks, it would cost these companies more per year, hundreds of millions of dollars more per year. If Prop 11 passes, it would reduce these costs to tens of millions of dollars per year after factoring in the scheduling requirements of this measure. Prop 11 would cost ambulance companies several millions of dollars to provide the training and mental health services required by the measure. This measure would also eliminate or reduce the amount ambulance companies would have had to pay in mealtime lawsuits that are still pending. Prop 11 would save local governments tens of millions of dollars in the cost that would likely have been passed on to them after the ambulance companies were hit with all of these extra expenses. While we're on the subject, the Daryl Johnson Show works hard to keep response times short whenever it's possible to prevent instances of doofuses in the voting booth. However, we need your help to keep these rescue missions timely and regular. Please consider donating at one of the links in the description to protect your community from these doofuses. A small donation here may prevent your community from voting to spend $200 million on giant lizard statues that would be placed in your local parks and by lakes where children play and elderly feed the birds. We're here to help, but help us help you. From Yes on Prop 11. Prop 11 establishes into law a long-standing industry practice of paying emergency medical technicians, EMTs, and paramedics to remain reachable during their work breaks in case of emergency, just like firefighters and police officers. Due to a recent court ruling, EMTs and paramedics, the closest ambulance to your emergency, may be on break, making them completely unreachable because all devices would be turned off. When you call 911, seconds can be the difference between life and death. It is essential that EMTs and paramedics are able to respond quickly and deliver life-saving medical care during mass casualty events like active shooter incidents and natural disasters. Prop 11 requires that emergency medical crews are paid by their employer to receive additional training that meets FEMA standards for violence prevention, active shooter, mass casualty, and natural disaster incidents. Yes on Prop 11. Daniel Iniguez, licensed paramedic, says, "As a paramedic, I want to be there when people need help. Prop 11 makes sure that when lives are at risk, emergency care will not be delayed and we are prepared to respond to nearly any disaster." Prop 11 ensures EMTs and paramedics have workplace protections. EMTs and paramedics should have workplace protections to ensure they are well rested. Prop 11 requires 911 ambulance operators to maintain high enough staffing levels to provide coverage during breaks. Prop 11 also says emergency medical crews will continue receiving an additional hour of pay if they miss a break and it cannot be made up during their work shift. Prop 11 provides mental health benefits for EMTs and paramedics. It takes a special type of person to be an EMT or a paramedic, and it can sometimes be a stressful job. Prop 11 requires employers to provide emergency medical crews with mandatory mental health coverage, as well as yearly medical health and wellness training. Vote yes on Prop 11 to protect public safety and ensure EMTs and paramedics can quickly respond when you have an emergency. From no on Prop 11. There is no on Prop 11. Nobody submitted anything. I hate to leave you without a no argument, so I wrote something up real quick just to be fair. So here we go. Everyone who supports Prop 11 is a wealthy corporate donor, and it's a sweetheart deal and a shell game. Everyone who supports Prop 11 is a racist and wants to hurt the poor and benefit greedy Wall Street bankers and special interests. So there you go. Well, this is a pretty simple situation. I don't have any strong feelings about this, but from my perspective, emergency workers seem to have plenty of downtime naturally built into their schedule. It seems most efficient that these workers take their breaks during that downtime and not cost their employers and the local government hundreds of millions of dollars to pay for specific downtimes when they can just take the naturally available downtime. If it was bad, I'm sure somebody would have written a no argument. So fine, let's do it. If you vote yes on Prop 11, you are voting to allow ambulance companies to require workers to stay on duty during breaks and receive special training and mental health coverage. If you vote no on Prop 11, you are voting to support the idea that ambulance workers should have off-duty break times. The Daryl Johnson Show says yes on Prop 11.